Well, welcome to McKenzie Health System. My name's Steve Barnett. I'm the CEO for the organization. And I have with me today Dr. James Sams. He's a family practice physician here at McKenzie and has been for several years. How long has it been now?
Coming up on 10 years now.
Wow, 10 years. So as most people realize, we have a crisis going on. Seems like we've had a number of crises over the past year. But the one that we're all familiar with and dealing with right now is COVID-19. So we thought that we would do this video so that we could inform you and help you better understand not only what's going on with COVID-19, but also some of the measures and the things that we're doing as an organization to prepare and deal with this and keep the community safe. So maybe, Dr. Sams, you could talk about what is coronavirus, what is COVID-19?
Right, and that's the thing about it. So coronavirus, we've had coronaviruses around for many years and we've been able to keep a tab on them. This one kind of gave us a curveball. It's a different species of it, and it even got its own name, COVID-19, and that's where it's come from. It's something that we should not fear, but we should definitely respect it along those same lines. It is a virus, and so when we talk about a virus, we should treat it just like we would a regular virus. I think one of the things that we need to deal with is where we're going with managing it now.
Yeah, and on that note, some of the things that we think are important steps that you can take as a member of the community, and quite frankly, all of us in healthcare are doing the same thing, and that is, you hear a lot about social distancing. So that means that we want to keep about 6 feet between each other, and we're doing that as we speak, as a matter of fact. Stay home. If you don't need to go out, containment is the key for this sort of thing. The more you're out and gathering in crowds, that's why you've heard Governor execute an executive order that says no crowds larger than X, Y, or Z to assemble, because again, it's about trying to contain and distance oneself from other people. And then the virus, it's particularly hard on the elderly. So the older you are, some say 65 and above, some say 80s, but when you have coexisting diseases like pulmonary disease or heart disease or diabetes, those things put you at more of a risk of not being able to manage the virus if you were to get it. And that's some of the reasons why we are particularly concerned about the elderly, particularly skilled nursing facilities, assisted living, and the like. Some of the basic precautions, you've always been washing your hands, 20 seconds worth of washing, which we call universal precautions. Avoid touching your eyes and your nose before you've washed your hands, because you don't want to pick something up and then put it on your face, inhale it, and become a carrier. And then if you cough or sneeze, do the same things that we've been doing and we've seen others doing for some time. Cough into your arm or elbow, and instead of shaking someone's hand, maybe do the elbow bump thing. Yeah, there you go. Big thing, and I get this all the time at home personally, is disinfect everything, wipe things down, door handles, hard surfaces, and so on. So, symptoms. What do you think?
When you talk about it, that's the thing that actually adds another curveball to this, because it is a virus. We have the typical viral symptoms: tired, beat up, run down, chills, sweats. Those are the main things that we look at. Sometimes we look for a more like a chest pain or a little bit more of a sick kind of picture. Now, certainly they're checking for temperatures wherever you go. That's something we can use as a barometer as well. And as Steve alluded to earlier, it's the elderly and the people that are more compromised: COPD, asthma, other immunocompromised people. So that's where not overthinking the symptoms, but treating the symptoms as they are.
So what if you are feeling like you're sick or have symptoms? What would you say people ought to do, James?
I think the biggest thing is basically use common sense. We're really blessed to have in our community really good setup for primary care providers all around. In our office, we have here in Sandusky, I have Suzette Walker, we have Mike Merkler and Lori Nugent, we have over at the Rural Health, Brandy Trapowski, Mike Lewis. We have in Croswell, Dr. Gormley, in Port Sound, like we have Dr. English and other providers that are on board for this. Contact them. Again, use common sense with this. If you are having fever and cough, let us know so we can take care of you before you get in the lobby. We can even meet you out in the car to see where you are. As we keep looking at this, again, do not overthink. Keep common sense with this. You don't need to wear masks and wear hazmat suit. Those are the overabundance of caution here. And what we're going to end up doing is being able to evaluate this even here at the hospital a little bit later. We'll be talking about is some of the things that'll be available to be able to get your blood drawn without going into the hospital. In the future, while we don't have the kits right now for testing, we're going to have those things available hopefully in the near future where we can have a true thing. But if there is question and you think you may have been exposed, keep yourself away. Stay away until we can confirm what's going on.
So would you recommend that they call the office or call the hospital if they have symptoms and they're just not sure, rather than coming in if they don't need to?
Very much so, yes. And like I said, we've all these places we can call them, call your individual provider, and we can make arrangements for what's going on. All the staff, the medical assistants are on board with this as well.
And some of it's a little bit confusing because people still get the flu, right? And does it act the
Very
same
much.
way?
It looks exactly like it, which is confusing.
So there will be reasons why you need to come in and see your primary care provider. There may be reasons where you think it's appropriate to come to the hospital. But if you think that you need to be tested, simply making the decision personally to be tested is not going to result in you getting a test, because this is a supply issue. And we at the state and at the local level are very cognizant of the fact that we have a limited number of test kits that we can use. So that's why we'll be screening patients, we'll be talking to them, asking them some questions about the symptoms that they believe they have, as well as where have they been in the last month, last 2 weeks. They've been on a cruise, if they've been out of the country. And how you respond to all those questions are really going to give us the best sense of whether or not we need to go ahead and swab you, get a sample, process it, coordinated with public health, because we want to know who you are and how to get a hold of you as we then move that sample through public health to the state where they'll be doing the actual lab testing. For the most up-to-date information, if you have the ability to look on the web or on the internet, Michigan Department of Health and Human Services is one of the websites that at least is Michigan specific in terms of information, and CDC's guidelines, Center for Disease Control, is also available at www.michigan.gov/coronavirus. And then of course McKenzie, we also have our website that we've created, and you can go there and you can see COVID-19, and also there'll be links on that page or that part of the website that you'll be able to connect to and get additional information. Many people are wondering what steps we've taken here at the hospital, and we've been pretty fast tracking for the last week. This thing seems to be escalating sharply. The number of cases that are being identified as positive at the state level is increasing in such a way that we would refer to it as a pretty steep slope. Suggests that we're having similar experiences in terms of positive cases showing up that we've seen in other countries. So again, the social distancing, the don't go places if you don't need to, kinds of activities that you would engage in, we would encourage you to do so. At the hospital, we're taking precautions because we need to make sure that anybody that's getting in here is not contaminating someone else. So we have locked the facility down, which sounds worse than it really is. It just simply means that in order to gain access to the facility, you need to, again, answer some simple questions, and then we'll make a determination about whether or not you are going to put anyone at risk. If a patient does come in contact with and may be positive, then we would come out and with protective gear on that we have, for our providers, and we would put a mask on you and escort you to a different entrance of the facility that's closer to a room that we would call an isolation room, because it's the airflow and the exchange of air in that room is such that it keeps airborne droplets away from others, and it contains it in that space. And we have a few of those that we've been able to ramp up for. I think one of the more important things is that we've identified over a week ago that we needed a team in order to manage all the information that we're being inundated with. And so we have internally at McKenzie a COVID-19 team. And on that team we have our infection control nurse, Becky Harris. We also have our hospitalist ED medical director, Dr. Hammond, who incidentally is also the medical director for public health in all the counties in the Thumb, which is really important because he has access to even more up-to-date information than many of us otherwise might have. We are processing that information and trying to bring all that complexity down into some simple messages that we can get out to the rest of the staff, so that on a day-to-day basis we're doing the best we can to protect ourselves as well as any of the individuals that might be coming in from the community. So, what about panic in the community? I mean, what are your thoughts? Have you been seeing any of that in the office? People calling?
Very much so, and the other thing about that is to use common sense. If you've not been south of 69, then the likelihood of you having contact is pretty minimal. Certainly, as Steve mentioned earlier, if you've done any traveling, things along those lines, don't overthink this. If you just all of a sudden have a fever, think, oh, I've got the virus. Most likely not, as far as that goes. Now, that said, over the next coming days and weeks, we are going to see an increase in numbers that you're going to see on the media. That has to do with the simple fact that now that we have testing available, we'll see specifically what we have. There are suspected cases, but then again, there are a lot of people that can have it and have no symptoms at all. Again, keeping your head and realizing that we are all in this community together. If you have an elderly person that is immunocompromised, you may want to keep your distance from them. Again, hand washing across the board. One of the things is we start talking about ways to spread it, ways they can spread around. Social distancing, as we talked before. For me, it's very difficult to keep from touching my face, rubbing my beard. I do that when I think. So if you can make a conscious effort, sit on your hands as far as this goes. Your tendency to want to kiss your grandmother and give your little kids a hug. We can still show affection without that type of intimacy. Certainly, as we said, do the cough in the elbow. These are little things that can make a world of difference across the board. And back to it. While you don't need to be paranoid about the disinfection, you should keep everything clean, especially high traffic areas that you share within your house and in public. Distancing, though, is the number one thing.
And so here at McKenzie, we think that we have taken very appropriate steps. We think that we've reduced the sources that we get information from, because there is a lot of misinformation out there on the internet. So I would encourage you, if you have questions, to use the resources that we're using, like CDC or the Michigan Department of Health and Human Services, or just look on our website at our COVID-19 link and see what information may be available there. Again, I think not panicking is key, just, being conscious of what we're dealing with and behaving appropriately, using some of those simple things that Dr. Sams has mentioned about washing your hands and wiping things down. At the same time, I don't want to suggest that you shouldn't take this seriously, because it's that lack of seriousness or thought that this will go away, is what gets people in trouble. And we've seen that kind of trouble that can be created in other countries, which is why we're beginning now to really exercise a lot of work and get supplies beefed up and be prepared for what we may be looking at. I think locally, we continue to offer services like we would. We're doing the same in the offices until we're told to not do that anymore. And then we'll just pull back as we are told to do so. But again, we'll be trying to develop some other ways in which you can talk to us using telemedicine devices, or limiting your exposure here at the hospital by being able to get a lab draw by driving up, and we'll come out to you. So we're testing those, and we should have those up and going in the not too distant future. Altogether, I think we have a great team here at McKenzie. I could not be more proud of the way everybody in this organization is managing this crisis, and hopefully interacting with you in the community. And we'll be here for you as we continue to go along. And if you have any questions, we certainly want to be that trusted resource that you can call and ask. Any parting words that you might have?
I think the big take-home message is this is like anything else, preventative maintenance, meaning keep something from happening. We want to keep the fire from starting, then have to put it out, like we would for blood pressure, cholesterol, any other issues like that. You want to take care of that before, if there is an emergency. Use your head. You may be feeling fine, but be aware of those around you that are other immunized compromised. One of the things we talk about is the physical way that it's present, but the mental aspect of it, worrying too much, can be another thing that I'm concerned about. So again, we have good resources to contact your primary care provider, get the real information, let them go over them, and put you at ease to see where we are, or if there is concern, take care of that.
All right, well, thank you very much. If you have any questions, you can always call your healthcare provider within the McKenzie Health System, or call McKenzie Health System directly, and we'll try to keep the information flowing and up to date. Thank you very much.
There you go.
That's right.